Hey, this is Dr. Dan Purser here. The date is 8/21/25 and it's a Thursday, and we've been digging into my reviews and found out, Jackson has, and found out from what we can piece together that not only am I the highest ranked single solo practitioner MD in Utah, but in the country. I'm now #1 in the country for solo practitioners, not big groups. You can't compare. That's not really a fair comparison. So I just thought I'd put that out there. #2, I did a lot of research on our glutathione because I'm always looking at it. It's a biotech product. We've got a lot of time and money in the patents and everything else on it. It's been, you guys know my struggles and everything with it and how hard we've worked on it. We're coming out with the liquid version again soon. It's much improved flavor-wise. We think it's a lot quicker than even the capsules. You use it topically or orally. But what I found, I was looking at cystic fibrosis because when I was a resident at Primary Children's up in Salt Lake City, they used to do these nebulized glutathione treatments. And the guys, the pulmonaries were like, it doesn't really work, we think, but it's supposed to help. And we don't know how much it really helps, but we do it every morning. We do it twice a day to these kids. I was on the red team when I was at Primary Children. I don't even know if they color code the teams now, but that was a long time ago. Been doing more research on that lately. This is what I found. Cystic fibrosis is a lot like homocysteine and the spike protein, actually. It's kind of weird. They all function by stimulating production of cytokines. Cytokines are mitigatable with glutathione. That's not my work. That's not my studies. There's just 1,000 studies now showing that cytokines go down if your glutathione level is high. And these are people who naturally, weirdly produce a lot of glutathione. They can't seem to be stopped producing these massive amounts of glutathione. And that's who the studies are kind of based on, because these researchers don't know that there are validated, functional, patented glutathiones. 2 of them, they're biotech level productions, like ours and Nayan Patel's and Chin Tron's down at Oro Pharma, and I helped those guys with clinical trials on their work. They were on our team in California at the university there at Keck and stuff. Cytokines that are produced by that kids with CF have problems with are IL-3, IL-4, IL-5, IL-8, which is the same as homocysteine does, and IL-13. You can look those up. I put a big research article. It's not that big. It's pretty easily readable for all you people who are interested in CF or have kids with CF or have family members with CF, so have cystic fibrosis. You can see it on my Substack. What's that Substack name? No, danpursermd.substack.com. That's it. Wow, that's easy. That's Jackson holding the camera. That's why it keeps wiggling. It's crazy what he's having to do to get this shot. According to the research, not what we've done, just what all the research is showing, should mitigate or drop those cytokines. We've got over 300 or more labs, I think now, showing that cytokines, the IL-8 dropped dramatically with in homocysteine with people who took the VARS Glutathione. So that's still anecdotal. They need to do a 10,000 patient study, probably multi-center trial, whatever, to really get validation, but it's of interest. The younger you can start kids on these things, I think the better they'd be. So when we come out with our liquid, it'll be a much more available option. It is patented, it is functional, it is validated. We call it VARS because that's the mnemonic we used in Southern California to describe a functional antioxidant, the laws of antioxidants. I said this before: validatable, absorbable, reduced, stable. We do cool stuff because we make it in our body. We make glutathione in our body. Just kids with CF don't make much for a number of reasons, and what they make gets used up by fighting the cytokines. So anyway, just my thoughts on Thursday morning, 8/21/25, about CF. Thank you for your watching. Thank you for the reviews. If I've taken care of you and you loved or hated what I did, either way, leave me a review. But by Google review, I got, how many do I have now? Oh, I thought it was over 800. Oh man, I'm a knucklehead. Okay, that's cool. Anyway, thanks. Love you guys. Take care. Talk to you soon.